My name is Raymond Brickhouse.
My name is Stephen Washington.
My name is Robbie Brown.
Well, my name is Ricardo Ramos.
I was diagnosed with full-blown AIDS in December of 1995.
Around 1985, I got tested for HIV, and I came up positive. I think I was maybe about 17 and a half years old when I got tested.
I've been diagnosed since, like I said, 2006.
I've been diagnosed since March of 2003. I'm actually the outreach coordinator. I definitely wanted to help people through things that I just didn't take it easy.
As far as my peers, they don't know because I haven't disclosed anything to my peers, but it's like they kind of sort of ask me, you know, where do I be going throughout the day, what do I be doing, what is this type of organization, and I'll just come up with something, but they just don't know. So it's like I don't really want to tell them exactly, but I think they'll be cool with it once they've figured it out, but I'm not ready to tell them yet.
I didn't disclose to my family about my HIV status until I was well into my 30s or so. And then by that time I had to give them time to accept my lifestyle as far as being transgender, you know. They didn't take the transgender situation very lightly either. They felt that it was an embarrassment on the family, and they gave me a pretty hard time about that. But then to come back years later with the status of being HIV, well, it took me by surprise because they were more sympathetic.
We offer HIV testing, and we also offer client services for people who are HIV positive. And we also have a wellness center for people who want to get their medical care here. So this is one of them places for people living with HIV where it's a one-stop shop. You come in, get your medical care, your case management. You can even use the food pantry if you need something to eat. And those are some of the services we provide here at APEB.
Hi, I'm Kevin Bynes, and I am the Health Promotion Director here at AIDS Project of the East Bay.
I'm Martin Kramer. I'm a physician assistant here at the clinic. Our job here in the clinic, we get newly infected HIV patients and also patients who have been infected, some of them for many years, and we do their primary medical care, which includes prescribing treatments, ordering lab tests, making diagnoses. We will deal with their HIV and any other problem that goes along with it. For instance, a lot of our patients have diabetes, heart disease, hypertension, and some of the things that go along with HIV, such as renal disease, and in particular we see a lot of heart disease here.
There are people who go without medical care and essential kinds of life-saving services because they can't bring themselves to go into a doctor's office or an agency like this one and say, I have HIV. And so they'd rather just ride it out as long as they can and jeopardize their health and ultimately their life because of the heavy internalized stigma that many people living with HIV experience. And that says nothing about the actual, the external stigma that, because it's justified. It's not like people are just deciding that I should have this huge sense of internalized stigma. It's things that they've heard in their communities and from their families and at their churches that have brought them to a place where they don't feel comfortable telling any of those people that they're HIV positive.
We're a lot of times the first one that tells them they're HIV positive. So in my lifetime I've told hundreds of people that they're positive, and then we decide which route to go, whether they start treatment or don't start treatment based on their numbers. Although the recommendation nowadays is that everyone who's HIV positive consider starting treatment. I've told hundreds of people over the years. I've been in practice for almost 22 years, and I've literally told hundreds of people their status. You get anywhere from shock and amazement to many people who already seem to know that they're positive. They may have had risky sexual encounters or behaviors that would lead them to believe that they might be positive already. So there are many people, when I tell them, they kind of say, I knew, or I had the feeling that I might have been positive. There's other people who are utterly surprised. They have been in monogamous relationships. I've diagnosed people who are positive and maybe had one sexual partner or one sexual experience, and they seroconverted because of that one encounter. So that can be a real shock for people who didn't realize you can get it with just one sexual experience or one drug sharing of a needle.
My name is Alvin Kwamina.
My name is Ronnie Eversley.
I'm the executive director, so essentially I'm the head coach for the team.
I am the clinical supervisor, and I also provide some client services. I specialize in trauma, women in trauma, and men in trauma, trauma and depression, trauma and pain.
Well, it's exciting, it's hectic. I think it's really important work that we do, so it's fulfilling in that way. I think some of the stuff that we have been doing lately is really innovative, so it's very rewarding in that way as well.
Well, there are two types of clients. Here I deal with men clients who are dealing with depression and trauma and pain, and with the women I do a group, and then with the men I do a supervision group also.
Well, the first thing that people can do to help our mission at AIDS Project of the East Bay is to talk about HIV and to talk about AIDS. Talk about it with your friends, talk about it with your family members, really raise the profile of this disease so that we all are aware that we're at risk if we have sex.
I've just seen so many people change their lives by dealing with their HIV status and taking their medications and getting their housing together, getting their food situation together, getting their kids back.
So really getting the message out that this is a preventable disease and sharing information about the disease, that it's also a treatable disease at this point. It's a chronic disease at this point. But then in terms of the agency itself, folks can come and volunteer. Folks can donate, of course. We're always happy to accept donations. And folks can come and learn. Actually, we're happy to have people come in to show them our facility, to provide training if we can set it up in advance for them, so that they're able to get the message out about HIV and AIDS.
The women that I work with, one of them is dealing with her sister's illness in addition to her own, and we were able to get her some resources to deal with both.
Well, there are lots of various devices that our health promotions program can help them with. They can have safer sex salon parties in their homes.
Most of them were in relationships with guys who were drug users, who they were in long-term committed relationships with, and they may not have necessarily known that the guy was HIV positive.
But really the most effective thing is when we move outside of sort of the organizational work and the work that requires a lot of pre-planning and just have casual conversations with those that are close to us. I mean, that's really what's most effective, because that one-on-one is where you really can have an impact, and where messages that, if others are around, we start filtering, we start wondering, okay, what are people thinking about my facial expressions, or I don't want to ask a question because other people are here. But when it's one-on-one with someone that we know and trust, we're able to really let our guard down and really let the information in.
So one of the things that we do at APEB to get the young folks, the younger people involved, is we hold an event at Franklin Plaza, which is 2 blocks up here on 14th and Broadway by City Hall. And the third Thursday of the spring and summer months, we have a testing event where they're at Franklin Plaza, and that's where a lot of the younger generation hangs out during the summer. So by us being right there in the middle of them, you know, it kind of helps it out, and they get a lot of tests, people tested over the summer. And so we do offer testing to clients as young as 12 who do not need a parent's consent. And like I said, usually by the event being at Franklin Plaza, that's where a lot of the young people hang out. So that's probably where we get a bulk of our testing for the young folks.
My name is Philip Sweet. I tested positive in 2001, and ever since I've been working as a volunteer. I help with outreach and risk reduction. Here at APEB, we do testing every Thursday from 12 to 4 on Broadway and 14th, and come down and get tested. Know your status. It's a good thing.
Okay, my name is Lisa, and the reason why I believe it's important for me and everyone else to get tested for HIV is because in 1992 my mother passed away from AIDS, and that led for me to be into foster homes and adoption. And I believe that if she was tested and had treatment earlier, that she would have had a better chance of surviving. So even though I don't have numerous sexual partners, I still support getting tested, and will test myself every time I change my partner to make sure that I'm safe.
My name is Lavelle Brevard. I am a prevention specialist. I'm an HIV test counselor / case manager. I've been doing this work for the last 12 years. I've been on this van all throughout Alameda County doing HIV tests. This is APEB Spring Health and Resource Fair that we have the third Thursday of each month from April to September, and it's to bring community awareness and to get people to test and know their status. So what we're doing here is called the HIV Rapid Oral Swab. It's an antibody test, meaning it's testing for the antibodies that your body will build once you've been infected with HIV. So you'll get the antibodies, your body will build the antibodies first before HIV is actually be able to be detected in your blood. This is the oral swab. It's 99.7% accurate. A blood test is 99.9. This test will test from the time you was born up until 2 weeks ago. You take this test, you swab once across the top of your gums, once across the bottom of your gums, and you place it in there. Now, it reads like a pregnancy test. So, this right here, what you're actually looking at, is a negative result. If it's negative, it'll show one line on the control area. If it was positive, it would have showed a red line right there, also another red line. So it would have showed 2 red lines for a positive test. The actual test reads in 5 minutes. They call it a 20-minute test because it's 10 minutes of getting paperwork, 5 minutes for the test to read, and an additional 5 minutes for them to ask any questions after they got their results. And that's the whole meaning behind the 20-minute test. But the test only takes 5 minutes to read. All right.
Cool. So they don't need a shot.
Nuh-uh.
Oh, okay. I didn't know that.
This right here. Modern technology.
That's something people should know, because a lot of people think they're going to get a needle in their arm.
Yeah.
And they don't want to go through that process. So.
Yeah, a lot of people who come in for testing automatically ask the first question, is it a needle? Is it a needle? And you'll be surprised. I mean, I have people come in with piercings, you know what I mean, and tattooed all up and still afraid to get the needle. But, you know, so I think it's important that it get out there that you can take a HIV test through a swab. And it's simple as just swabbing the top of your gums, the bottom of your gums, wait 5 minutes and have your results.
And you don't have to wait 2 weeks like the olden days and like have a panic attack trying to do inventory of who you slept with.
Same day results.